button here. So there we go. So right now I'm going to turn it over to Eric Stockton, who is with the Appalachian Regional Commission, and he's going to provide us with a little bit of background on the project before we get into the site demonstration. So Eric, I just unmuted you, so you should be ready to go.
Thanks, Jamie. Good morning, everybody. Thank you for joining us for this webinar. As Jamie said, I'm with the Appalachian Regional Commission in Washington, D.C. I'm the Health Program Manager for the Commission. And I wanted to give a little background about the project, the overall research project that the healthinappalachia.org website is part of. So for those who might not be familiar with ARC, the Appalachian Regional Commission is a federal-state partnership created by Congress in 1965 to address the critical economic and social problems in the Appalachian region. The commission is made up of the governors of 13 states and a federal co-chair who is nominated by the president and approved by the Senate. The current federal co-chair is Tim Thomas, and the current state's co-chair is Governor Phil Bryant of Mississippi. Our mandate is to focus attention and resources on reducing the socioeconomic gap between Appalachia and the rest of the nation through a variety of activities, including grant making, regional planning, advocacy, partnership development, and of course, research. And you can find out more about ARC at our website, www.arc.gov. So, as I mentioned, the healthinappalachia.org website is part of a bigger set of research activities that ARC began back in 2015. The overall project is called Creating a Culture of Health in Appalachia, Disparities and Bright Spots. This is a partnership of ARC, the Robert Wood Johnson Foundation, and the Foundation for a Healthy Kentucky. The overall objectives of this project are to document health disparities in Appalachia, identify what we call bright spots, communities with better than expected outcomes in terms of health, examine the factors in the success of those bright spots communities, and disseminate all the findings to instigate change in the region. So the first component of this work was published in August 2017. It's available on our website. The Health Disparities in Appalachia report examined 41 measures of health in 9 broad domains. These included measures of current health status, such as mortality, morbidity, behavioral health, general health and healthcare systems, such as child health and quality of care, and risk factors and determinants of health, such as lifestyle, community characteristics, and social determinants of health. So there we go. That's a summary of those 41 measures and the groupings. So the key findings of that disparities report include these shown here. All mortality measures that we examined are higher in Appalachia than in areas outside the region. Mortality rates may be affected by changeable behaviors. Resources are generally lacking within the region. Improvements have been made in many measures, but the region is falling further behind the nation as a whole despite those improvements. So for many measures, the rest of the country is improving more quickly than ARC, than Appalachia. And for many indicators, conditions are disproportionately worse in the region versus the nation. So as I said, the Health Disparities Report is available on our website. And sorry, I think I've lost a note. And the website, on the ARC website, just note that the data set used is a national data set and it's available for download on the project page. There are a few limitations to the disparities report. Some of the data sets are limited, such as we weren't able to use county level data for some interesting and important health measures. And to some extent, the age of some of the publicly available data can be frustrating. Today's webinar will introduce an important element of this project, which is a new website called healthinappalachia.org. The website houses all of the data from the Disparities Report. Audiences for this website would include government and human services agencies, health departments, legislators, policymakers, economic development agencies, foundations, researchers, the press and media, and community coalitions. And uses of the website and its information might include community needs assessments or health needs assessments, priority setting, measurement and evaluation of different services, background for developing funding and grant proposals, community presentations on local conditions, legislative and local advocacy, comparison and peer county identification, and research activities. So most of the rest of today's webinar will focus on this website, but I wanted to mention the remaining components of the Bright Spots project. This week we published 2 additional pieces of research. One, identifying bright spots in Appalachian health, a statistical analysis, and case studies of 10 selected communities. These are also available on our website at www.arc.gov. So these reports provide complementary data and analysis of conditions in the region, taking a strengths-based approach that's intended to find common themes and promising practices in places that are doing better than expected. And information from these reports will be added to the healthinappalachia.org website later this year. And so with that, I'll turn it back over to Jamie, and she'll provide a demonstration of the website. After her demo will be available for questions, or you can contact ARC for assistance at www.arc.gov. So Jamie, I'll turn it back to you.
Great, thank you so much, Eric, for that overview of the project. As mentioned, we are going to now get into healthinappalachia.org and do a demonstration of the data and reporting tools that are available to you on the site. If you are interested in following along, you're welcome to do so just by visiting healthinappalachia.org. Everything that I am doing for you today or showing you today is going to be demonstrated live, so you'll be able to follow along hopefully pretty easily. So this is the home page of the site, and as you can see here, we do have a couple of links that I just wanted to point out here on the home page. We do have a link to some key findings, so if you are interested in just really learning about some of the key findings that were pulled out of this report, this is a really great place to start. So we have just a few issues here: social association rate, smoking, physically unhealthy days, mentally unhealthy days, and poisoning mortality. And you can click through these and just get some very high-level information about this indicator and why they are considered key findings. We also do have some interactive charts and dials that you can to view as well. So that is one area of the homepage that I wanted to point out. The next 2 areas are direct links to the interactive report, which we are going to demonstrate here in just a moment. And then also we have created a few starter maps for you. So built into this website is an interactive map room that includes all 41 measures that were included in the disparities report. You are able to add these dynamically to a map, and we will demonstrate that later in the presentation. If you're not familiar, though, with geographic information systems or map rooms, these starter maps here on the homepage are really a great place to start. They have preloaded data for you, and you're able to explore that data yourself and really get a start and get a better feel for how the map room functions without just jumping in and starting from scratch. So I'm going to scroll back up here to the top and just go through now this main navigation. So Eric already talked a little bit about ARC and some of the partners that were involved in this project. We also have a section that's just a little bit about the Appalachian region. So you can see here what states are included, and it gives you also just a little bit more information about Appalachia and the geography included. We also have a project overview. So again, if you're interested in seeing just a quick glance of the indicators that were included in this disparities report, this is a great place to see all of those indicators listed very simply on this page, and the 9 domains in which they are categorized. So you can see here current health status, generational health and healthcare, and then we also have risk factors and determinants of health. As mentioned, all of these are included in the interactive report. So I'll go ahead and get into that. So that was right here under the About section. We also have then the disparities report. So there are 3 options here. We have the interactive report, we have the map room, and then we have downloads. So as Eric mentioned, all of the data that was used for the Health in Appalachia for the disparities report is available for download, both on arc.gov and on this site here. So if you are interested in getting either the PDF reports or the raw data itself, you can see right here, it is the last option. It is called data file, and it is in Excel, so you can download that for use outside of the system if you're interested. So jumping right into the disparities report itself. So this is going to produce an interactive report. But in order to produce that interactive report, we need to select our location and some data indicators. So the first thing that we want to do is select our location. You can see here as I scroll down that we have all of the states that are included in Appalachia listed here, and you can select either from the state that is in this part of the state that is included in Appalachia, or you can select the part of the state that's not included in Appalachia. So we wanted to make sure that you understood that designation. So we do have these nice designations here, non-Appalachian and Appalachian. So you can see here all of the states that are included. So I'm going to go ahead and choose Tennessee. And so now I've chosen Appalachian, Tennessee, so I can choose a series of counties that I'm interested in here. So we'll go for Blount County. Let's see if we can find a few others, maybe Knox, which is nearby, and also Sevier County. So the nice thing about this report is you can choose either one county that you're interested in, or you can choose multiple counties and see data for all 3 counties and do some comparison. I can, in fact, go back and click this select state option, and if I wanted to select some counties in non-Appalachian Tennessee, I could do that as well here. So we will select another county here. We'll just do Lake County. So here you can see I've selected 4 counties as my, my service area for this report. I could also choose by state if I were interested in doing that. So again, I could select one state or multiple states to include, or I could select a sub-region. The Appalachian area is broken out into these regions: central, north central, northern, south central, and southern. So that grouping of states and counties would be included in each of those subregions if you selected region. So I'm going to go back here to Tennessee and just select the counties that I'm interested in again for demonstration purposes. Get a couple of counties that are grouped together. So I've selected 3 counties, and my next step is going to be to click this data indicators button. So included here are all 41 measures that are part of the overall report. And to see the measures themselves, you can click this down arrow on the right-hand side. So as I open up each of these data categories, you can see the individual indicators that are included here. So things like heart disease mortality, cancer mortality, injury mortality. So that's one that I want to include. If I click the I button or the information button next to each of the indicators, I can receive more information about that indicator and determine whether it's something that I want to include in my report or not. So you can see here, this is a little bit of a map of the area that I'm looking at. I get a quick overview of injury mortality, and I can see the data source here is from the CDC and the dates that it was produced. So I can go ahead and close that. I can decide that that's one of the indicators that I want to include in my report. As you see here, you can click each of these caret buttons and it's going to open up again the individual indicators that are included under each of these categories. You can select one or you could select all. You can select one by just clicking the checkbox next to each of those indicators or unclicking it if you've selected the wrong one. If you want to select an entire category, you will just go ahead and click the checkbox next to the category itself rather than the individual data indicators. You can undo anything that you've done and just select individual indicators if you're interested. So I'm just going to select a few here to show. But you can see that these are all of the indicators that we showed on that project overview page and that are included in the report itself. So I'm going to just go ahead and make my final selections. We do have some trend indicators that are available as well that are in addition to the 41 core measures, and they are available over time, so you'll see those trend indicators. So now that I've selected a series of indicators for my report, the next things I'm going to do is click the report button. You can go back and modify your location at this point if you've selected an incorrect location. But now we are in the actual interactive report itself. So you can see here at the top, the first thing that it tells me is the counties that I've selected. So I can make sure that all three of the choices that I selected are included: Blount County, Knox, and Seaver. And then we get into each of the indicators that I've selected. So the first one here is injury mortality. Just a quick note that there is this hamburger menu at the bottom of each page, and if you click on it, it's going to allow you to jump between the indicators that you've selected in the report. So I'll go ahead and close that. But I did want to take you through the major components of each indicator in the report. So first, you're going to find the category name, and then you're going to find the indicator name. So we're here looking at injury mortality. So underneath that, you're going to find what we call a stem sentence or a description of the indicator itself. So you can see here it tells us a little bit about the injury mortality rate indicator, that it is based on a per 100,000 population calculation. It tells us a little bit about what an unintentional injury is, and it tells us a little bit more about how this broad indicator includes things like injuries and accidents, motor vehicle accidents, poisoning, and this also includes drug overdoses. So you can see here underneath that descriptor sentence, we have a data table. You can see here it includes the report area, which we've selected as 3 counties in Tennessee, and it breaks each of those counties out so we can see the exact value for each of the counties themselves. It tells you what sub-region that these counties are included in. So it looks like I've selected 3 counties that are all considered South Central. I can see the individual injury mortality rates for each of those counties. And then it also gives us a national quintile. So it looks like these 3 counties rank about right in the middle when compared to other counties in the Appalachian region. We also get some benchmarking information here as well. So we can see that it is benchmarked to the state of Tennessee. We can see Appalachian versus non-Appalachian Tennessee here. We can see it benchmarked to the sub-region, the total Appalachian region, non-Appalachian US, and then the rest of the United States. So again, if you do want to do some comparison, these benchmarks are a really great way to see how your county or grouping of counties is doing in comparison to the rest of your state, the rest of Appalachia, and then the rest of the United States. Underneath each of the data tables, you'll find a link back to the original source. So here you can see this is from CDC. You can get a link back to the actual mortality file. You can also show more details that tells a little bit about the 57 vital statistics and the collection information from the Centers for Disease Control and Prevention. Then we also have an inset map. So it highlights the 3 counties that we're interested in, Knox, Blount, and Sevier County. And then we have also our legend here. It is displaying the same information that you see here in the data table, but you can see it as a map, which is nice for those of us who are visual learners. In addition, we can also see the same information included in this bar graph. So you can see here that all of these light colors are the benchmarked areas, and then these darker colors are the areas that we selected for our report area. As you scroll over this bar chart, you do see the information is dynamic, and you can see the rates for each of the areas selected here. Scrolling down, I'm getting into my second indicator, so you can see that is demonstrated by a new category, behavioral health, and then we see here around poisoning mortality as well. So again, we have this nice descriptor text that tells us a little bit more about the indicator itself. We have, again, our data table that breaks out the information by county, state benchmarks, region benchmarks, and then the rest of the United States. We also have this national quintile information here, so it looks like we're doing a little worse in these counties in comparison in terms of the quintile ranking than the rest of the region. And again, we have this nice map. So as I scroll through the report, you can see that for each indicator, there is consistency in the components that you see for each. Again, this nice descriptor text, the data table itself, the inset map, and then the bar chart. So one thing I did want to point out is that you can click this View Larger Map button here at the bottom, and it will take you into the map room that we've created for the Health in Appalachia project. And so you can see here that it is interactive. You can click on each of the counties and again, get that same information, the infant mortality rate per 1,000, and then also the national quintile name. It gives you also the county name, so you know that you're in the right place. You can see over here on the legend on the right-hand side that it does nicely outline in red the areas that you've selected for your report. I'll come back to the map room and show you how to save, share, and export a map like this. Use our additional tools or add additional data. So continuing to scroll through here, again, I want to point out that there is this hamburger menu option at the bottom. So if I did want to, for example, jump down to our trend data, I can do that very easily just by clicking the indicator that I'm interested in. So here you can see we also have some infant mortality data for the area for the 3 counties that we've selected. The one thing I did want to point out though is this is one of our trend indicators that we have available. So we understand that anytime you can show trends over time, change over time, it's always significant. So you can see here that we're able to look at 2 points in time. We can see each county that we've selected in comparison to the South Central subregion, the Appalachian region itself, non-Appalachian US, and then the rest of the United States. And this again is an interactive data visualization. So as you hover over each of the trend lines, you can get more information on that specific indicator. So I'm going to go ahead and scroll back up to the top, and I can do that very easily just by clicking this arrow button, and it's going to get me there to the top. And I did want to point out a couple of options that you have. At any point in time, you can kind of go backwards, we'll say, in the report and say, wow, I learned a lot just from the selection, the small selection of indicators that I've chosen. I do want to add some additional indicators and look at additional information. And again, you can simply just check the boxes next to each of those indicators and just load a new report. And it will include, as you can see here, it will include those additional indicators that you've selected, and you're able to scroll to those very easily, view that information. So once you, or if you're interested in taking this report maybe to the next level, sharing it with your community, a legislator, some of those action steps that Eric had mentioned at the beginning, there are a couple of easy ways to do that. So first off, you can download this report as a PDF. It does take a minute just to convert all of the data visualizations, the data tables, everything that you see here will come with you into a report, a PDF report that then you're able to, print or share with others in an email. We do also have this share button, so you are able to share the report on social media or via email. We do have a print option, so the print option is a little bit different than the PDF because it will set page breaks for you. And then we do have an export option, so if you're interested in exporting this data to Excel, we have a very easy way to export it to Excel, and I will see if this will open here. It might take a second. But you can then get that raw data, and with Zoom, I now have to share my Excel screen. There we go. And you should be able to see, oops, one second, clicking around here. You should be able to see that data in the Excel file itself. So if you are interested in pulling this into, for example, another report or into another data analysis system, you can do that very easily through this Excel function here. So I'm going to go ahead and close that and go back to, here we go, excuse me. There's a lot of share options on Zoom, so I apologize. There we go. So you are able to export that then to Excel. So that's just a quick overview of the report and how it works. Again, you can access it and start fresh each time just by clicking that interactive report option from the menu and selecting the area that you're interested in. Next, I'm going to go into the map room. So we saw a little preview there of the map room by clicking into the View Larger Map within the report. But you can also select individual indicators to add to a map and be able to view those just within the map room or the GIS system. So there are a couple of ways to get to the data here. Automatically, it's going to load those categories that we saw the data is organized under. So we have behavioral health, healthcare systems. And again, you're just going to use these carrots, click on each of them to drop down the indicators that are available to add to a map. If you know the name of the indicator that you're interested in, you could also type it in here and click the search button, and it would load all of the data indicators that met that criteria. So we can see here that we can select, again, one or multiple indicators to add to a map, and we have these information buttons as well where we can get more information about the indicator before we add it to a map if we're interested in learning more. So here I'm just going to go ahead and I'm going to select I'm going to just select, for example, one indicator to add to a map to start with. Just as a note, we do have some additional indicators included in the map room that are not included in the report. And those include these county economic designation status and then the rural urban county types. And these are really just foundational kind of reference maps for you to know the economic designation status and the rural urban county types that are available. So as you can see here, as I open each of these, I can select any of these indicators. So we'll go ahead and select average mentally unhealthy days per month, which is a BRFS set from 2014. So I have selected it by clicking the checkbox next to the indicator that I'm interested in, and now I'm just going to click Add to Map. So you can see automatically it adds that indicator to the map, and I'm able to see this information for all of the Appalachian region. If I were interested in zooming in or zooming out at this point, over here on the left-hand side, we have these nice plus or minus buttons. So I can zoom in and get a little bit closer view of the Appalachian region, or I can zoom in to a specific county. If you're a little more savvy, and I'm not as good at this, you can use your scroll function on your computer to zoom in or zoom out, or you can click and double click on an area that you're interested in, and it will also zoom in and zoom out for you. You can use that minus button then to zoom back out. There is one more way. If you're interested, you can select a specific location here. So I could, for example, type in a county that I'm interested in, and it's going to try to predict what I'm asking for. So here, just by typing in Knox, it pulls up Knoxville, Tennessee, and maybe that's the area that I want to zoom into. By selecting that, it's automatically going to zoom into the Knoxville area for me here. So we spent some time in Tennessee before, so I'll go to, let's say, West Virginia instead. And I can just see the whole state again by typing in West Virginia, maybe zooming out a little bit. Now I can see the outline of the state itself there. Over here on the right-hand side, I do want to point out that we've got some information in the legend that is of interest. So here we're looking at average mentally unhealthy days per month per person. Again, this is a BRFS data set, and we can see then the values associated here. So it looks like 4.2 to 5.6 mentally unhealthy days per month is that highest category, and then we have 2.1 to 3.0 being the lowest. At any time, I can click on any of these counties that I'm interested in, and again, get that information by the county. So we see here that 4.4 days in Marion County, West Virginia, and that is included, or that is considered part of the worst, one of the worst national quintile ratings. You can see that's the dark area here, but if we were to go to another area that's a little bit lighter, for example, in Maryland, we can see that it's a second best national quintile there. So that's just a quick and easy way to kind of view some of the areas here. You can see the light and the dark, and that corresponds then with the legend over here. I am also able to label. So right now I have this turned on the map. I am able to label if I'm interested in seeing those values by county. Rather than clicking on the county themselves to get the values, I can label it. I can also change the transparency if I'm interested, and this is helpful if you do want to add a reference map. So we do have reference map layers available. So here we're looking at just our simple legend with the one data indicator that we selected. But if I select this larger hamburger menu here, it's going to give me some reference maps that are available. So I can turn on things like, for example, place names or highways. A lot of times, you know, folks orient themselves based on highways, so sometimes that's helpful to turn on or off. There are county boundaries that are inherent to this map, but if you did want to make them a little bit more apparent, you could turn those on. You can also label the counties themselves, and as you're zoomed out, this looks a little crazy, but as you zoom in, those county boundaries can become very helpful in, again, orienting your viewer to where they are in this map here. Another option, let me zoom back out and turn those county labels off. We can, in fact, turn on also those subregions in Appalachia. So you can see here we've got the subregions laid out, and you could turn on or off that full Appalachian region there. We do have some additional maps, some topography maps if you're interested, a street-based map and satellite. And again, that's where this transparency layer comes in here. So you can see some of the topo maps, or you could see the street-based map underneath. And as you zoom in, again, you're going to be able to see more of that granularity available underneath the data layer that you've selected. We have also a satellite map here. So those are just some of the additional reference maps that you can turn on and off. You can toggle back and forth between the legend itself and the map, the reference maps pretty easily just by clicking those two buttons. Again, you can see some of the data info if you're interested in that. You can search for more data, or you could remove this data layer if you weren't interested in keeping it on. A couple more options in the map room. If you did want to look at two layers at one time, you can click that Add Data button up in the top right-hand corner, and you can click through, and let's say we're going to look at average physically unhealthy days per month alongside mentally unhealthy days. So what you can do here, this map checkbox, you can toggle those on and off. So I can turn off the physically unhealthy days or the mentally unhealthy days. I can turn back on those layers and see the comparison amongst the counties that I'm interested in. So you can add more than one data layer to the map. We also do have some additional tools that are available to you. So let me zoom in here a little bit to an area. You can query the data. So if you are interested in saying, I want to see those counties that have greater than 3 mentally unhealthy days per month, I would choose the greater than symbol, type in the numeric value 3, and then run the query. And what that's going to do is that's going to give me all of the counties in that area that I had just been looking at. It's going to highlight them and say, all of the counties in this area meet that criteria and are over 3. And you can scroll over very easily and see how what those values are and how they change. You can add additional query. So if you wanted to also have the quintile ranking, you could do a multi-query, multi-selection query if you are interested in getting a little bit more sophisticated. You can see this again on the map, but you can also show an attribute table. So if you are interested in downloading that, for example, into an Excel file, you can do that very easily. Again, it'll give you the county name, the numeric value for unhealthy days per month, and then the quintile rating. And just by clicking this download data button, it'll produce an Excel file for you with all of these records and the same columns. So it'll look very similar. So those are some advanced options there under the query functionality. We also have select data functionality. So if you did want to select a specific area, select by radius. So you wanted to see a 50-mile radius, for example, or you wanted to draw a specific area you were interested in. It's going to highlight, again, the counties and the data that's available within that area. And you can show an attribute table and download that to Excel as well. So that's a nice function if you're maybe serving a region, or you want to look at a legislative region or something along those lines. We do have some measure tools. You can get geographic coordinates. You could measure a path or measure an area. these may be useful to you, you can simply, click between two areas and you can see how far that is, and you can see some elevation and slope information if that's something that would be useful to you. We also have a mask tool, and I find this very helpful when doing presentations. So here again, I had I'm going to turn my 2 layers back on. I'm interested in just an area within a state, just a couple of counties. I could select an entire state if I were interested, or I could select a couple of counties. And you can see here that it really masks the areas around the counties that you've selected. And this makes for a nicer map if you are interested in pulling this down, which I'll show you how to export it into, for example, a PowerPoint presentation. You can change the transparency, so maybe you want to see the counties around it a little bit, or maybe you don't want to see the counties around it at all, and you just want to show the area that you're interested in. You can do that and have a very nice output this way by having this mask tool turned on. So I'm going to go ahead and delete this then so we can get back to our normal map here. And then we can also look at a swipe layer. So right now we have 2 data layers selected. So this is another easy way to kind of look at 2 data sets at one time. So you can see down here at the bottom, the left side is physically unhealthy days, and then the right side is mentally unhealthy days. So as I swipe, now I'm looking at mentally unhealthy days. As I swipe right, I'm going to be looking at physically unhealthy days, and you can see how those 2 indicators change over time. We do have this available for those trend indicators, which makes it easier to view those on a map. So those are some of the advanced data tools that we have available to you here. You can get to those 2 ways. You can click this tools bar here at the bottom of the legend, or you can click this tools button here at the top. And at any time, if you just want to start over, because sometimes that happens, you can click this clear map button and you're just going to start from scratch. And at this point, you would need to click the add data button and choose an indicator to add to the map. So let me just choose an indicator very quickly so I can show you the final options that you have here in this map room. So again, we do have a share option, so you can share this easily via social media, via email, those types of things, or you can export the map. You can give the map a title. You can choose its landscape or portrait option. You can just get the map image only or just the legend image only. You can get this as a PNG file or as a PDF document. And then you can also set a custom width if you'd like. And that'll export the map, and again, that's a great way to pull it into maybe an infographic, a report, a PowerPoint presentation that you're doing to be able to display this data for other folks. So that is an overview of both the report and the map room. I showed you also where the downloads are available. The last item here in this menu is the contact us item. So if you do have any questions about the data itself or about the tools that are available on the site, please feel free to reach out to us by using this form. Both the CARES staff where I work and the ARC staff are copied on these requests. So if it is something that our team can't answer, the ARC team will be able to answer if it is more related to the data itself. So we're happy to help you and answer any questions that you may have. So at this time, I'm just going to pause here and see if we have any questions that have come in. If you do have questions, feel free to use that chat function in order to reach out to us. I don't see any questions currently, so I'm going to wait just a few minutes and see if anything else comes in. At this time, Eric, are there any other items that I missed that you'd like me to address, or are there any other questions that you would like to address at this time?
Your work in working in health and an economic development context in the region. So we're excited about the tool and would be happy to be able to help anybody make good use of it.
Great, thank you. We'll wait here just a few more minutes to see if anybody has any questions, but yeah, we are very excited to release this site to you all and hope that you are able to make some maps and reports that you can use in your community, to better inform the decisions that you make and maybe even apply for a grant or some funding to support some healthy communities work. So we'll stay on the line here for just a few minutes, but I don't see any other questions. If you do have questions following up, if you get into the tool or you get into the map room after this webinar, feel free to use that contact us button. Again, our teams are both on the line for answering any questions that you may have. We are recording the webinar today, so we will be posting it and making it available. If you want to share it with others, there will be a link. You'll be able to share it with other folks. Doesn't look like we have any questions, so we're right before the top of the hour, so we'll go ahead and log off. But again, thank you all for your time today, and we hope to see you around the healthandappalachia.org website. And we hope you have a good rest of your day and a great weekend. Thank you.